If you have a chemical abortion, you take a pill, maybe two, and then a few hours later take a second group of pills, and then you would develop bleeding like a period, similar to a heavy period. The length of the period after the pills is very variable. Most women are going to bleed for at least a week. Sometimes you might see just heavy clots, but a lot of times you'll see something that actually looks different. It'll have maybe a little more jelly type of consistency to it. You may actually pass something and it will look exactly like a baby. The medications that they use for this have side effects that can cause anything from diarrhea to pain to nausea to headaches to dizziness. Though the medications probably are relatively safe, it's not something that goes without some sort of side effect in almost everybody. All abortions are involved with the machine that generates suction. It's kind of like a medical version of a vacuum cleaner. It's attached to a tube we call a cannula, which basically comes in different sizes, which relate to the size of the pregnancy that's in there. Once that's put together, then the cervix is typically looked at much like a pap smear. And then a dilator will be used to dilate the cervix to a width that the cannula size would be able to pass. Then the cannula is placed into the uterus, and the suction machine is turned on. All the contents of the uterus are drawn through a cannula tube into the machine's basket. This includes blood clot, some fluid, and the tissue of the baby or fetus. Now, if the pregnancy is past 14 weeks, a different procedure is completed. An instrument is inserted into the uterus, which then splits the limbs and bodies apart and removes the pieces one by one. Then that's stopped, and then typically there's a kind of a sharp, what we call a curette, is then used to kind of sweep the inside of the uterus, and then the cannula is placed again, then the contents are removed again, and then when all that's done, then they wake you up and they bring you back to the recovery room. There's risks to any surgery, right? So one of the risks you have in surgery is that as the cervix is opened up, sometimes it can tear or bleed. The biggest risk is that something would go through the entire uterus. Most of these procedures are what we would call a blind procedure, meaning no one's looking to see. They're basically just using the instruments to empty the uterus. I would never tell you that you would never be able to have a baby later after an abortion. There's no way to know. However, there's always a chance that the procedure will, anytime you do surgery, you leave scar tissue behind. So there's always possibility you could leave scar tissue in the uterus. I've seen people who have had abortions who then have children. I've seen people who have had abortions who then have miscarriages. And I've seen people who have had abortions who never are able to conceive again. The early abortions, or the chemical abortions, there are people who have had terrible side effects to these medications. They have had significant bleeding from these medications. There are people who have bled to severe anemia with these medications, and there are people who, after taking these medications, have actually died. I know this wasn't the easiest thing for you to do. Something inside you made you make a phone call. Why? Maybe you need one person who's going to kind of speak to you, not you as mother, and you as friend, and you as worker, and you as member of a community, but you as a human being. What I'm hoping you'll find as you go through what we talk about here today, what you do and your counselors you talk to, is to be able to make that choice for yourself. Now, do we hope that you don't choose the abortion? We do. But you need to know all of the possibilities that are around you, which you are not going to get anyplace else.